Hi, my name is Kim, and I'm doing this video series for YouTube because I had hammer toe surgery a week ago, and I've been searching for some videos on post hammer toe surgery of actual patients, and have not found any. So I thought it would be a good tool to maybe share my experience. I had 3 hammer toes worked on last Monday, December 23rd, 2024. So I'm 1 week out, and I'm just going to give you a little idea of my experience 1 week out. So let me show you my toe. I actually had 3 hammer toes repaired, and they had to cut ligaments because I had my second and third toe were split like a peace sign. And so it's been 1 week today. I should have had the surgery probably 2 years ago, but I did wait because I wasn't ready for it. So I finally decided to do it over the Christmas break, and it's going to be a 8-week recovery before I have to go back to work. So I thought this would be a good time to do it. My first day after having the surgery, a week ago today, I came home and I had a pain block put in, so it wasn't terrible. The surgery was about 2 hours, and I did pretty good that day into the evening. I slept on the recliner in the living room, had ice packs on it, and they sent me home with a oxy with Percocet and a nausea medication because I've had nausea and vomiting with my past surgeries with the oxy, and so I was taking that as prescribed every 4 hours. Monday night, I was in so much pain I couldn't sleep. I didn't sleep at all that night. The oxy did not touch the pain. It was a level 10, I would say. So I was in pretty much in agony. And that morning, my husband woke up around 6:30, and I told him I'd had a rough night and couldn't sleep at all. And we do have an ice machine that I had for shoulder surgery, so he went up into our crawl space and brought that down and filled it with ice. And we had the shoulder wrap. He wrapped it around my foot, and I used that whole day, and actually used it for 3 or 4 days. And that certainly made a difference in my pain level. I was able to actually handle the pain that day. I kept it elevated on a pillow, actually 3 pillows. They say nose to toes. It should be, your foot should be elevated up to your nose. And so yeah, that really did make a huge difference. Still taking the oxy that day also, which was Tuesday. And I ended up taking the oxy until Thursday morning. And I ended up going off the oxy and just going on the Tylenol because I didn't want to be on that for very long. And I tried to get into the boot that they had fitted me for pre-op, and I could hardly get the boot on, which is the Air walking boot, which I'll take a picture. I'll show you that. So this is the boot they gave me. It has this fancy pump on the side that you can control it. But anyway, on Christmas Day, we were getting ready to go to my daughter's, and I tried to get that boot on, and I could barely get it on. It was so tight, and it hurt so bad. And I did have it on a little bit walking around the house using the restroom and stuff, but it hurt every time I put it on. And so actually, when I had the boot fitted pre-op, the nurse just put my foot in it and my sock, and she started with a medium and said it was too big and moved me to a small, which fit fine with my sock on. But then once I had my surgery and the foot was wrapped and swollen, the boot was way too tight, and just pressing on those toes that had just been operated on, and just yeah, it just was not working. Well, I wore that thing at my daughter's for a couple hours on Christmas Day, which was Wednesday, 2 days post-op, and I ended up coming home in so much pain that I took the Oxy again and slept on the couch that night, but my back was hurting. So I'm thinking, I got to get off the couch because now I'm having back pain. I actually had to put a pain patch on my back. And so on Thursday morning, one day after Christmas, go back one day on into Christmas Eve evening, I did send a message in my chart to my doctor to let him know that I thought that the boot that they had fit me with was too small. I explained it had been fitted with only my sock, and then it didn't fit. Even when I was at the hospital the day of the surgery, after the surgery, the nurse was trying to put the boot on, and she said, "The boot's too small." And then she asked me, "How did they fit you for this boot? Did they wrap your foot?" And I said, "No, just with my regular sock on." And she goes, "Well, the boot's too small." So my tip would be to make sure, if you're getting your boot pre-op, to have them wrap your foot, because it's not going to fit you if you just have it fitted into a sock. So I sent that message to the doctor on Christmas Day evening saying that it was too tight, I couldn't wear it. And I got a call 8 o'clock the next morning on Thursday from the nurse saying that they're going to try and get me in to see a doctor closer to me, because my surgery was almost an hour away from the house. Anyway, they were really nice. I got a call from the nurse at 8:30 from a closer location, and she said, "Come in anytime that day." And so my husband took me in, and the nurse was great. She fitted me for a medium-sized boot, which felt wonderful. Kind of talked a little bit about how I was feeling. I told her I did not have a bowel movement yet since Sunday, and so she gave me a recipe that she said the ortho doctors, the surgeons, swore by. They call it witch's brew, which I'll share with you. It really did make a difference for me. You take 4 ounces of prune juice, 4 ounces of grape juice, and warm that up in the microwave, and then you mix that with 30 ml of milk of magnesia and drink it down. You don't put the milk of magnesia in the microwave, just the juices, warm them up, and then add the 30 ml of milk of magnesia, stir it up and drink that, and it really got things moving for me. And I ended up only having to drink it one day, and it was helpful because you don't want to get constipated when you're on that pain meds. So, kind of just going forward, I'm on week 1. I got another boot. I've been I haven't gotten constipated. I'm able to get the bowels moving. The pain is under control. I'm sleeping in the bed now, so I don't have to worry about that. The back's feeling better, and I'm using the knee scooter. I went out on Saturday, which was 5 days post-op, and went to the store with my husband and had my knee scooter. Did great. I was able to do a little shopping. I have a basket on it and put some things in there. And so week 1, I say I'm definitely past the hard stuff, and I'm going to start chair yoga starting today to try and just keep moving, because I'm used to going to the gym. So I'm going to end it at that, but I will try to post some pictures of my foot before, as well as any pictures I may have taken the day of surgery, along with this video, so that you can have some ideas of the before and after. And I'll just continue to post every week as changes may happen, or any ideas that I might have that I can add. But yeah, I hope this helps, and I'll let you know how it goes in the next week. Thank you.